so we'll just go ahead and get started. Hello, my name is Dustin. I'll be helping you today. I see from your intake sheet that this is your fourth week of basic training. How's everything been so far?
Okay.
All right. I see that you're coming in because your right hip is hurting.
Yeah.
Can you tell me what's been going on?
It's kind of started off kind of up in the hip, obviously, and started off just kind of when I was running, and now it's to the point where as I'm rucking and I'm running, it's hurting, and it's starting to hurt afterwards, and even when I'm trying to like go to sleep or sit down. So.
Okay. Have you been out to like the land nav or anything like that yet?
Not yet. We go next week.
Next week? All right. How long has the ruck marches been?
We just did our second one. It was 8 miles.
8 miles, all right. Did it start hurting at the beginning, midway through?
Really short after I think we hit the first or second mile, it started hurting pretty good.
I go back to the running. Does it hurt at the beginning of the run, middle, end, or?
It used to hurt at the end, but now it just hurts when I start running.
Does intensity increase it, decrease it, or?
The intensity of the run?
Yeah.
Yeah.
Yeah, all right. So the harder you go, the more it hurts. All right. If you had to give me like a 24-hour sort of description of the pain, sort of like, does it hurt more in the morning, like after PT, evening, or has it progressed to hurting like all the time, or?
It's progressed to hurting all the time.
All the time. So how did it initially start?
Started out after our first ruck march.
First ruck march. How long? What week was that in?
I think the second week.
Second week. All right. Have you noticed any popping, clicking, catching, or anything in there?
No.
Any numbness, tingling, or anything?
No.
No. Any low back pain?
No.
No. Any pain in the knees?
No.
No. Just sort of right up here.
Just in my hip.
Right there. Does it feel like it's on top, down, or down?
Kind of just hip? All in it, all straight
hip?
through it.
All right. Have any pain when you're sitting?
Yeah.
Does like the duration of how long you're sitting affect the pain?
Yeah, seems to be, but thankfully we don't sit a whole lot. But
yeah.
I am noticing it.
Yeah, I know you have to sit Indian style sometimes. Does that cause more pain, or?
It's just it's really uncomfortable.
Just uncomfortable. Does it feel like there's any pressure in there?
No, it just hurts.
Just hurts. All right. Can you describe the pain?
Just it's painful. All I know is it kind of elevates as I'm doing stuff, and when I stop, it's still there. I notice it, but it's still hurting.
All right. Is it sort of sharp, stabby while you're doing things, or is it dull when you're doing things, or if you could use those type things to describe it?
It's kind of both. It's dull if I'm not doing anything, but if like we start rucking or running, it intensifies. I do kind of get a stabbing sensation.
All right. We're just going to go over some just some questions, some risk factor questions. All right.
Okay.
Are you lactose intolerant?
I am.
You are?
I am.
All right. Do you take like a calcium or vitamin D supplement?
No.
No, you don't take any of those. Did you smoke before you came into the military?
I didn't. My folks did. My dad did pretty heavy.
Pretty heavy, so you pretty significant exposure to secondhand smoke. Were you an excessive drinker before you came in? No. All right. When you were smaller, or even in middle school, high school, did you get outside and play a lot, or do a lot of activities outside?
I played outside like a normal kid, but I wasn't like a marathon runner or anything.
Did you play any sports or anything before you come to the military?
Not actual sports. I just played outside, like baseball outside with the neighborhood kids and stuff. So.
What was your physical activity like before you got here?
I guess average.
Average?
Yeah, pretty average.
All right. So how many days were you weight training, running, or?
I didn't weight train at all.
Okay. Let's see. Any type of birth control use or anything like that?
Yes.
Yes. All right. Is it Depo?
No.
No? All right. Are you pretty regular with cycles, or are they
No.
irregular?
No.
All right. All right. Family history of osteoporosis, like weak bones or anything like that?
My mother.
Your mother? All right. How about grandmother?
Not that I know.
Not that you know of. All right. So we'll just go ahead and have you lay back. And it's your right side, right?
Yeah.
All right, go ahead and just lay back. I'm going to look at your left side first. All right. You said most of the pains look right through here.
Yeah.
Is it pretty spot on, or does it sort of go around
It's kind of all through it.
all through? All right. hurt when I push on it?
Not right there.
Not right there. Any pain out in here?
A little bit.
A little bit. I want you to curl your toes back towards you. I want you to keep this leg straight on the table. I want you to raise this one up as high as you can, okay?
Okay.
All right, go ahead and raise it up. Down. All right, raise this one up. You pain anything with that?
A little bit.
A little bit. All right, there you go. All right, let's lay on our side and face that wall. All right, same, let's put our feet straight out. Keep this one on the ground. Let's raise this one up as high as we can. All right, any pain with that?
No.
No? All right, I want you to push up against me. All right, there you go, relax. I want you to pull down. So, no, not like that way, just try to pull straight down.
Oh, I got you.
Pull straight down. All right, you can roll over, face me. All right. Again, let's raise this up as high as we can. Pain or anything there?
A little discomfort.
A little discomfort. All right, let's push up against my hand.
Yeah, that hurts.
That hurts?
Yeah.
All right, push down.
Yeah, I'm just.
Any pain with that?
Yeah.
All right, let's roll over on our stomach. All right, I want you to scoot down just a little bit. You go curl your toes back towards you. All right, just go ahead and lay flat down. I want you to keep your right leg on the table
Okay.
and just look at me. I want you to just like try to keep this part of your body on the table and just bring it back, all right?
Okay.
All right, so go ahead and bring it up.
With my left leg?
Yep, left leg. Relax. All right, let's do right leg. Any pain or anything with that?
Yeah, a little bit.
Yeah. Does it increase when I do that?
Yeah.
All right, there you go. All right, let's curl our heel to our butt. There you go. Back down, heel to our butt. All right, there we go. All right, bring it back down. Now just bring this leg up. No, straight up. All right. Now does it feel like the other side is
No.
not too bad at all?
Not bad.
There you go. All right. That's it.
That was okay.
Okay. That's it.
That was good.
That's good. All right, let's roll over, face that wall. All right, I just want you to lay on your side, scoot towards me just a little bit. All right, keep this leg straight.
Okay.
Just relax. Let me bend your leg.
You said straight.
Yeah, sorry. Any pain with that?
No, it feels kind of good, actually.
Feels kind of good. All right, let's roll over on the other side. All right, just relax for me. Pain with that?
Yeah, that one hurts.
That one hurts. All right, let's roll back over on our back. All right, let's cross our leg. All right. Let's relax. Let's cross it. How's that hurt?
Yeah.
Hurts. All right. Let's try to keep our hips nice and flat. Now, does it feel like a stretch, or where does it hurt at? Right in there?
Yeah.
Does it feel like it's on top or down inside?
Inside.
Inside? All right, let's do this one. All right, just relax. Yeah, there's a big difference there. All right, just relax. All right. So that was no pain or anything with that one, right?
Nothing.
How's that?
That one's not fun.
Do you feel like a pinch or anything?
Just pain.
Just pain?
Yeah.
Look through there.
Yeah, that hurts.
That hurts. How about there?
Yeah.
Yeah, all right. Let's come up off the edge of the table, so how we were sitting when we were talking at the beginning. All right, just relax. In there.
Mm-mm.
Mhm.
Yeah, I feel that a little bit.
A little bit.
Yeah.
All right. So you're just gonna watch me. What we're gonna do, let's go ahead and just put our butt here at the edge of the table. All right. We're gonna pick up our right leg, put our hands underneath it.
A right or a left?
Just put our, you're gonna mirror me.
Okay.
Yeah. And we're just gonna lay back. Just fall down the table.
Okay.
How's that?
It's uncomfortable. It just feels weird. That's okay.
Is it okay? Just a stretch?
Yeah, just a stretch.
All right, sit back up. All right, other leg. Nope, remember to go underneath.
Underneath?
There you go, yep.
Okay. Oh,
How's that one?
that one hurts.
Hurts?
Yeah, that hurts.
Hurts. Just relax. All right, let's go ahead and sit up. Come on. Yep. Let's lay back down on the table. I just want to clear some things on your stomach.
On my stomach.
Mm-hmm. All right. I'm just going to push back here a little bit, okay?
Okay.
I know you haven't complained of back pain, but I just want to clear it right quick. Nothing when I do that.
No.
Nothing when I do that.
No.
Look at that.
I
Nothing there.
just feel pressure.
Full pressure. All right, let's roll over on our side and face face that way. All right, just relax. How's that one?
That's sore.
Sore? All right, roll over, face me. Nothing there.
No,
All
I
right.
just feel it down here 'cause you're pushing on it.
All right, let's roll over on our back. All right. All right. Nothing with that.
Just a little pressure. That's about it.
Pressure. Nothing with that. No. All right. Let's go ahead and stand up. All right. So, what I want to have you do, let's just do single leg balance. All right. So let's stand on the left leg first.
Okay.
All right, let me move this table up. All right, so stand on our left leg.
Okay.
Let's just tuck our knee up like this, like a stork. All right, any pain with that?
No.
Let's do the other leg.
I don't really have good balance to begin with.
That's all right. If you fall to the ground, it's not that far. How's that?
A little more difficult.
A little more difficult?
Yeah.
All right, let's set up for squats. All
I
right,
don't
so-
do those.
All right, let's do 5.
Just all the way down?
Yep, all the way down as low as we can go.
Oh, okay.
All right, how's that?
That hurts.
1. Let's do 2. Now tell me if it's starting to hurt more, okay?
Okay.
How's it feel as you go along? Hurts?
Getting a little aggravated.
Does it feel like there's any pressure in it, or it just hurts?
Just hurts.
Just hurts? All right. Let's go back to that left leg. All right. Well, actually, let's just do both.
Okay.
Let's do 5 just hops. You don't have to jump too high. Just,
Okay.
Just double leg hops.
All right.
How's that?
I feel it, but it's not super painful, but I
Not
do
super
feel
painful. All right. When you say you feel it, how does it feel?
it. Just pain.
Pain? Does it feel like it shoots anywhere, or
Yeah, it kind of goes down.
goes down?
Mhm.
All right. Let's stand on that left leg again. Let's do 5 hops, single leg hops.
Or just on this leg?
Yep, just on that leg. All right. So that looked easy. All right. Let's do the other side.
I can barely balance on this one.
Mm-hmm. How's that?
Those hurt.
It's hurt? If it hurts too much, you can stop.
Yeah.
All right. Let's go ahead and sit back down. All right, let's go ahead and have a seat.
Okay.
How's it feeling now how's it feeling since we did all that stuff?
Worse than when I came in.
Worse than when you came in?
Yeah.
I want to send you up to physical therapy. All right. I'm going to crush you up and just give you sort of a dead man's profile until you seen by them.
Okay.
Just your past history, how the things have been going on, the risk factors for a stress fracture are there. I don't know if they told you, but femoral necks are pretty common in the military. So I just want to roll that out before you go on with training.
Okay.
All right?
Okay.
You have any questions or anything for me?
When do you think I'll be back?
It
If
de-
it's not broke or
If
anything.
it's not broke or anything, they'll send you back, and we'll start working on trying to loosen everything up around there. All right. They may you may get an X-ray. It may show there's nothing there, but if the clinical signs and symptoms are still there, they may order a bone scan.
Okay.
So if they order a bone scan, don't freak out.
Okay.
All right. It's just the next step, so, because sometimes x-rays may not show it,